Llanos, Salar, Vidal, from el Hospital Universitario Fundación Jiménez Díaz de Madrid, España. The title of her abstract is T2 Magnetic Resonance for Selected Adult Patients Experiencing a Tertiary Hospital with Sepsis Code.
Thank you for your presentation. Well, as you know, sepsis is a life-threatening entity characterized by organ dysfunction, followed by a secondary to a bacterial, viral, or fungal infection. Sepsis could be classified into different phenotypes according to microbiology laboratory results. First, we have proven sepsis, that it only occurs in almost half of the patient. Then we have probable sepsis when we have another molecular test positive or another culture positive instead of the blood culture. And in 30% of the cases, we have possible sepsis, that is when we don't have any microbiological test that is positive for the microorganism that is causing this bloodstream infection. In addition, despite its slow turnaround time and its suboptimal sensitivity, blood culturing remains at the gold standard. So, in the last few years, many culture-independent techniques have been developed to give a rapid diagnosis, ideally in a few hours, to give us information about the pathogen that is causing this infection and also for the detection of some antimicrobial resistant genes. Those rapid diagnostic tests include a variety of technologies that they differ in their complexity, price, speed, and identification ability. In one part, we have those tests that are performed from positive blood cultures. Here we include the nucleic acid amplification methods and the new rapid antibiotic susceptibility methods. And from direct blood, there are emerging new techniques as the T2 device. The T2 device uses a novel technology that is based in a PCR amplification accompanied by a magnetic resonance. The main advantage of this technique is that it can be performed directly from the whole blood that is extracted from the patient. So in that way, you skip the time-consuming step of blood culturing, and it can give you our results in 3 to 5 hours. The T2 has 3 different panels. First, we have the Candida panel that include the 6 main Candida species that are more frequently involved in candidemia. Then we have the T2 bacteria panel that include 6 bacterial species that are frequently involved in sepsis, and the T2 resistant panel that include resistant mechanisms from gram-positive microorganisms and also from gram-negative microorganisms. In my hospital setting, we have especially used this technique when there was an activation of the sepsis code in patients at the emergency room and also in hospitalized patients. We have also used it in intensive care unit patients in septic shock and in oncomatological patients with infectious symptoms, especially in those ones that were hospitalized for a long period of time with negative cultures. And it can be also useful when there is a suspicion of candidemia with previous negative blood cultures. From May 2019 till November 2022, we have performed in total 348 assays in 234 patients. We have used mostly the bacteria panel, and overall our rate of positivity of the Candida and bacteria panel was around 26%. Regarding the results for these panels, we have obtained in total 71 positive results with almost a 60% of agreement with positive blood cultures. The microorganism that we have most frequently detected was E. coli, followed by Klebsiella pneumoniae. I have to say that we have especially used this technique for sepsis of urinary origin at the emergency room. Attending to the T2 resistant panel, the mechanism that we have detected more often was the CTXM. This is in accordance with our local epidemiology, and we also have observed that when we obtain a T2 bacteria positive result accompanied by a T2 a negative resistant result, there was a good correlation with the phenotypic test performed when the microorganism was growth in blood culture. Then in this table we have a summary of the T2 positive results in comparison with blood culture results. We have a complete agreement between both techniques in 41 cases, and we even detected a polymicrobial infection caused by Klebsiella pneumoniae and Enterococcus faecium. As the T2 is a very sensitive technique with a very low limit of detection, we expected to have some positive results of the T2 accompanied by negative blood cultures. In some cases, in around 10 cases, we have obtained the same microorganism detected by the T2 in another type of samples, like a urine culture or synovial fluid culture. We also have some clinical doubtful results, especially those regarding positive results for Pseudomonas aeruginosa and Acinetobacter baumannii, as they are environmental microorganisms that can produce a contamination. Of the 163 T2 negative results, 113 were in agreement with blood culture, and in 38 of the cases, the blood cultures were positive for microorganisms not included in the panel. The problem was with 12 cases that were positive in blood culture for microorganisms that were included in the T2 bacteria panel. If we want to implement these techniques in our routine care, it is very important that this technique should be implemented when there is a diagnostic and antimicrobial stewardship programs, because it's very important to identify which patients could benefit from this technique. And also our mission from the microbiology laboratory is to deliver the results at the right time that the clinician could take an action on them, as it could be as escalating or de-escalating an antimicrobial treatment. So in that way, these techniques, rather than increase or consume extra health costs, they can really help in an optimal management of the patient. So my conclusions about our experience is that the T2 is a sensitive and specific method with a reasonable short response time. It can really help in establishing a prompt target treatment. It should be used always as a complement to standard diagnostic methods. And it is also necessary to establish new protocols that include this technique for its systematic use in routine care. So thank you very much for your attention.